Hello there. You've heard us often talking about the fact that it's not the number of cases that matter, but the number of deaths. And which is why we have spent a couple of days trying to analyze and study and understand the rate at which deaths actually take place in India. And it's justified and reasonable to do that at a time when the deaths that we are seeing every day is now approaching the 400 mark. Yesterday, I was talking a little bit about the fact that over the country as a whole, 17 people are recovering for every one person who is dying. Let's now just zero into some of the differences that we are seeing in states. Now, when it comes to coronavirus cases, we all know that they are the big three. You've got Maharashtra and Delhi and Tamil Nadu. And these three states are recording by far the vast majority of coronavirus cases that are happening. The three cities in particular of Mumbai, Delhi and Chennai are accounting for about half roughly of the coronavirus cases that are coming up every single day. Now, when it comes to deaths, again, there are three states that account for most of the deaths that have taken place in India. In fact, three states contribute 71% of all the deaths that have taken place in India. But here's the twist in the tail. It's not the same three states as the ones I was just talking about where the cases come in. Maharashtra is there on both the lists. Maharashtra, with its 100,000 cases, has also seen something like 3,700 deaths. So it's number one on the list. And yes, Delhi shows up in both the lists. Delhi with its 36,000 odd cases and 1,200 deaths. But when it comes to the third state on both the lists, Tamil Nadu actually doesn't show up anywhere in the top three, maybe even the top 5 states that have seen very high deaths. Tamil Nadu, for all the 40,000 cases it has seen, has only seen 467 reported deaths. Now, I know in all of this you could keep arguing about statistics and has everything been reported. I'm just going by the official data on the Ministry of Health website. So Tamil Nadu, 40,000 cases, only 367 reported deaths so far. The third state that actually shows up when it comes to deaths is actually Gujarat. 22,500 cases only, so not in the top 3 when it comes to cases, but when it comes to deaths, Gujarat has actually seen 1,415 deaths so far. Gujarat's actually seen even more deaths than Delhi has. Way more deaths than Tamil Nadu has. And that also means that when you look at the ratio of people recovering to the people who are dying, so the recovery rate, it's actually, when it comes to Gujarat, that ratio is not very good, because in Gujarat, something like 15,000 people have recovered, 1,400 people have died. So approximately 11 people are recovering, 10 to 11 people are recovering for every person who dies. Closer to the global average, not the average that we are seeing in Delhi, in India, which has been by and large much better. So Gujarat needs to keep an eye on that death rate. And obviously, Maharashtra and Delhi remain the two which are number one and number two, both when it comes to deaths and also pretty much there when it comes to cases. Delhi, in particular, is continuing to prove a major headache, and that's perhaps why tomorrow there's going to be a meeting between the Home Minister, the Health Minister, and the Delhi Chief Minister to try and figure out what should be done in Delhi.
Union Home Minister Amit Shah and Health Minister Harshvardhan will on Sunday hold a meeting with Delhi Chief Minister Arvind Kejriwal and Lieutenant Governor Anil Baijal to review the COVID-19 situation in the national capital. Members of the State Disaster Management Authority will also attend the meeting, the Home Ministry tweeted. Dr. Randeep Guleria, the Director of All India Institute of Medical Sciences, who is also part of the centre's COVID-19 panel, will also be present. This comes after Delhi reported over 2,000 fresh infections for the first time on Friday.
India's COVID count surged past the 3 lakh mark on Saturday after a record spike of over 11,000 new cases. The country recorded 11,458 new coronavirus infections and 386 deaths in the biggest single-day spike in the country, according to the Health Ministry data on Saturday morning. This is for the first time that India has seen more than 11,000 cases in a day. The total number of COVID-19 infections in India is now 3,08,993 and the number of deaths have gone up to 8,800. 1,484. It's taken only 9 days for the cases to go from 2 lakhs to 3 lakhs. Over 1,54,000 people have recovered so far.
Maharashtra government has slashed the rates of the COVID-19 tests conducted by private laboratories from 4,500 to 2,200. Talking to PTI, State Health Minister Rajesh Tope on Saturday said that the lowering of rates for the tests would provide a relief to the people. 2,200 rupees will be charged for collecting the swabs through viral transport media, while it would cost 2,800 rupees for collection of swab from home, he said. The minister added that action will be taken if any lab charges more than the fixed amount.
Hours after India crossed the 3 lakh coronavirus cases mark with the highest single-day spike of 11,000, Congress leader Rahul Gandhi shared 4 graphs on Twitter showing the rise in the number of new coronavirus cases. Data of each graph corresponded to each phase of the lockdown in the country. Along with the graphs, he tweeted an anonymous quote, "Insanity is doing the same thing over and over again and expecting different results." The government has added sudden loss of smell and taste to the list of novel coronavirus symptoms. When the first set of criteria for COVID-19 testing was fixed in January 2020, it comprised of fever, cough, and breathlessness as symptoms. Later in May, with a surge in COVID-19 positive cases, gastrointestinal health issues such as diarrhea or vomiting were also added. Any patient with one or more symptoms is allowed to get tested for COVID-19.
The Labour Ministry has been sealed for 2 days after 24 officials tested positive for COVID-19, and it will open after the Shram Shakti Bhavan, which houses the ministry, will be sanitized. The 24 officials of the ministry who tested positive for COVID-19 have been asked for home isolation, and 17 other officials who also came in contact with them have been asked to home isolate. The number of officials of the Railway Ministry and other union ministries testing positive for COVID-19 in the last few weeks has been rising steadily.
As the coronavirus cases keep rising, Punjab has announced a total lockdown on weekends and holidays. Only essential shops will be allowed to open on these days, and people's movement will be totally restricted apart from essential services. Punjab will also seal its borders with other states. Further, people arriving in Punjab by plane, train or road will have to undergo a mandatory 14-day quarantine. The state has reported close to 3,000 cases and 63 COVID deaths.
With the highest single-day spike of 2,137 COVID-19 cases, Delhi's count of coronavirus infections crossed the 36,000 mark on Friday. The number of deaths due to the disease climbed to 1,214, with 71 deaths reported on Friday, according to the Delhi Health Department. This is the first time that over 2,000 cases have been reported in a day in Delhi, which is the third highest number of coronavirus cases in India after Maharashtra and Tamil Nadu.
Beijing has shut down several markets, including the largest Shinfadi wholesale food market, and locked down 11 residential communities near it after 6 new domestically transmitted coronavirus cases were reported. 9 cases have been reported in the capital city in the last 3 days. Officials in Beijing found the coronavirus on a chopping board of imported salmon at the Shinfadi market. China's National Health Commission said on Saturday that 12 new infections were registered in other parts of China.
Brazil on Friday surpassed the UK in number of deaths from COVID-19 as the pandemic continues to spread in Latin America's largest nation. The country is not second only to the US in terms of deaths due to coronavirus. Brazil reported 909 new deaths on Friday, according to government data, bringing the total death count to 41,828. The number of infections rose by 25,982, pushing the tally to 8,28,810.